Introduction. Hello everyone. In this video, I will explain Mycobacterium tuberculosis, the bacteria that cause tuberculosis, TB, in a simple way so that everyone can understand, even if you're not from a medical background. History of Mycobacterium tuberculosis. Let's start with the history of Mycobacterium tuberculosis. Ancient times. TB has affected humans for thousands of years. Signs of TB were found in Egyptian mummies from 3000 to 2400 BCE. 19th century. In the 1800s, TB was very common in Europe and North America, known as the White Plague due to its severe impact. Major discoveries. In 1882, scientist Robert Koch discovered the TB bacteria, proving it caused the disease. 20th century. The BCG vaccine was developed to prevent TB, especially in children. Antibiotics like streptomycin were discovered, making TB treatable and reducing its death toll. Modern challenges. Some TB strains have become resistant to antibiotics, making treatment harder. TB is still a major health problem in many parts of the world, requiring continuous efforts to control it. What is Mycobacterium tuberculosis? Mycobacterium tuberculosis is the bacteria that causes TB. It is very good at surviving inside the human body. During the latent phase of TB infection, the bacteria hide from the immune system using special proteins. They live in granulomas, which are organized structures of immune cells that the body creates to contain the infection. In healthy people, TB usually stays controlled within these granulomas. However, if the immune system becomes weak, TB can become active again. Besides causing TB, research shows that M. tuberculosis can also be linked to other health problems like lung diseases, autoimmune diseases, and metabolic syndromes. Recent studies have found that M. tuberculosis can interact with the human microbiome, which is important for keeping the immune system balanced and healthy. Understanding how it manipulates the immune system and influences other health conditions is crucial for developing better treatments for TB and its related health issues. How do we get infected with Mycobacterium tuberculosis? Now, let's talk about how we get infected with Mycobacterium tuberculosis. Spread. TB spreads through the air when someone with active TB coughs, sneezes, talks, or sings. Infection process. 1. Breathing. In. You inhale droplets containing TB bacteria. 2. Latent TB. Your immune system traps the bacteria. You have no symptoms and can't spread it. 3. Active TB. If the immune system can't control the bacteria, they multiply. You get sick and can spread TB. Risk factors. 1. Close contact with someone who has active TB. 2. Weak immune system, e.g., HIV, diabetes. 3. Living or working in high-risk places, hospitals, shelters. 4. Traveling to areas with high TB rates. 5. Substance abuse, drugs, alcohol. Prevention. 1. Avoid close contact with TB patients. 2. Ensure good ventilation. 3. Use masks in high-risk areas. 4. Get regular TB screenings. 5. Vaccinate with the BCG vaccine. How is TB treated? How is TB treated? 1. Antibiotics. TB is treated with a combination of antibiotics. The most common ones are isoniazid, rifampin, ethambutol, and pyrazinamide. 2. Treatment duration. Treatment usually lasts 6 to 9 months. 3. Regular checkups. Patients need regular checkups to ensure the treatment is working and to manage any side effects. 4. Complete the course. It's crucial to finish all the prescribed medicine to fully eliminate the bacteria and prevent resistance. How is TB tested? How is TB tested? 1. Skin test, Mantoux test. A small amount of TB protein is injected under the skin of your forearm. After 48 to 72 hours, a healthcare provider checks the injection site for a reaction. 2. Blood test, known as interferon gamma release assays, IGRAs. It measures the immune system's response to TB bacteria. 3. Chest X-ray. Used if skin or blood tests suggest TB. It helps to look for signs of active TB in the lungs. 4. Sputum test collects mucus from your lungs. The sample is tested in a lab to check for TB bacteria. Thank you. Thank you for watching. I hope this video was helpful. Stay informed and stay healthy.